Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
Today on Wellness Wednesdays, I will discuss movement disorders in terms of symptoms, management, and new treatments coming out. Movement disorders are involuntary movements. The simplest one that we know is when we drink too much caffeine, our bodies start to get very jittery. But for a lot of people, this can persist without caffeine involvement. The most common types of movement disorders are essential tremors, Huntington's disease, Parkinson's disease, and dystonia, just to name a few. Some of the most common symptoms for well-known movement disorders, for example, is essential tremor, where people have shaking of their limbs, and it gets worse when they're trying to eat or drink from a cup. Another one is dystonia, where people get involuntary muscle contractions. So they notice like their hands are curling, their toes are curling, and sometimes this can be painful. Another one is Tourette's syndrome, where people have an urge to say or move a certain body parts and they feel relief afterwards, and they don't understand why is this happening to me and other people don't have similar symptoms. And lastly, Parkinson's disease, one that's very well known and common, is people notice they have shaking in one of their limbs at rest and their hand movements are very slow. They're having difficulty opening a jar or even trying to walk. Their gait's getting slower and they're taking smaller steps. The field of movement disorders is growing and new treatments are coming out every year. Treatment can range from medications. There's new ones coming out to help symptoms such as tremor, slowness in movement. We also have devices in case someone is not comfortable with a medication and wants something a little bit different. And if medication and devices no longer become effective because symptoms have progressed after 10 or plus years, then we have procedures such as deep brain stimulation to help control tremor, slowness, and to improve walking. What is deep brain stimulation? Deep brain stimulation is a surgical procedure where we make two small openings on your skull up here, and we put in these skinny little long leads in an area of your brain that causes problems such as tremor, slowness in movement, and walking problems. Now these leads are attached to little wires that go under your skin to a battery pouch here under your chest, under the skin, and it almost looks and feels just like a pacemaker. And what's fascinating is that with my computer, I can connect to you wirelessly, create an electrical field that helps dampen those tremors, improve the slowness in your hands, and help you walk faster. UT Medical Center offers research, clinical trials, and procedures that a lot of patients had to drive 2+ hours to get. And that spent a lot of their money, their time, and was extra stress upon them. And so we're very excited that we're able to offer this in East Tennessee and our surrounding areas. The COVID-19 pandemic has affected movement disorders. A lot of patients were fearful in the beginning to come into clinic and seek care because they were afraid of being infected, and that fear, even though it's better, it still continues. I want everyone to know that we're taking every precaution to make sure you're safe when you see us and that you get the care that you need right now. If you start to notice involuntary movements that aren't getting better or getting worse, I urge you to seek evaluation with your primary care physician. If you want to know a little bit more about what you're experiencing before you see your primary care physician, I can suggest that you look at our website. We have all kinds of information about different symptoms, different diagnoses, and treatments that we have available here today.